I They've their user things like they really look that's start with and wow, they were that's good, yeah, with information. It, it's you have to really like yeah. Yeah, like there we are selling old PVMA merch. It's up here in this corner if you want to take a look after the meeting. Shirts are $10. Hoodies and crew necks are 15. They're super cute. We're just gonna sell them until we get our new merch put out in November. Another announcement, we are starting herds. If you weren't here last year, it's kind of where we build like small groups that can get to know each other a little better and do activities outside of just meetings. So like, for example, last year we did herds trivia, which was super fun. And it'll be like a group of 6 to 8, depending on how many we get signups for, and then 2 exec members. It's just a nice time to hang out. We do study tables and stuff, like go to Panera and it's all paid for like 3 year dues. So that link to fill that out is in the dues paying group meet. If you can't access it, let me know. And then also, if you didn't see Addison before the meeting, she's handing out Halloween goodie bags, so make sure to get one. I'm gonna go ahead and introduce Dr. Kimberly Cole. She's gonna be talking to us today about. So my apologies for not having my title sign up there, but I didn't get it in. Apparently. So anyways, it's nice to see so many faces that I recognize and so many faces that I don't. So I'm Kim Cole. I teach in the Department of Animal Sciences here at Ohio State. I am a professor and extension equine specialist. The majority of my appointment is working in extension, but that really doesn't mean a whole lot. So we all do teaching, research, and outreach and engagement. So a little bit about my background, because probably many of you are going to have similar paths in that there is no linear path to do the things that you might want to do. So I did my undergrad at Virginia Tech. And then I thought I wanted to go to vet school, and then I realized I didn't and wasn't sure what I wanted to do after that. And then there was a career fair that the college had, so I went there, had a couple of interviewed, and ended up getting offered a job being an assistant farrowing manager for a swine company. So I moved to North Carolina and ended up within a few months managing a 1,250 sow farrow to finish on-site finisher unit for about 5 years. The only swine production experience I had was swine production class, where I processed 1 litter of pigs for that. So while I was working in North Carolina, I really enjoyed working with 4-H and youth development. And in order to be an extension agent, you had to have a graduate degree. So I ended up going to school at the University of Arkansas, where one of my instructors at undergrad had moved. So I ended up doing my master's in reproductive physiology with swine as animal model for working on vaccines. And then my cardiovascular phys professor, because my goal was to go back to North Carolina and be an extension agent. And when taking a class, I ran into him at a mall when we actually still had malls that you would go into. Was in an Eddie Bauer store, ended up talking to him for 2 hours, and he convinced me to stay and do a PhD, which I had not planned on doing. So I did that, but I didn't, he was a poultry science professor, and the only thing I knew about poultry was that I like to eat them. Uh, so it's like, I don't want a poultry science degree, so I ended up doing a cellular molecular biology PhD with that. And then I did my postdoc at the Poultry Health Lab in Fayetteville, Arkansas, the University of Arkansas. So a lot of my PhD work and postdoc work was a combination of some bacterial work from a reproductive physiology point, but most of it was from food safety. So looking at Campylobacter and Salmonella in pre-harvest poultry, because if we can get rid of it in the live bird, then we don't have to worry about it in the process and food chain. For that, so did some vaccine work, had some patents from doing that. So a very non-linear path. And while I was doing my postdoc there, I interviewed for the job here, and this is my 18th year here at Ohio State. So I came in doing poultry research and then kind of crossed that over into equine research. My lab logo is a horse with a chicken sitting on its butt, because the food safety research is a lot easier to get funded than equine. My sample sizes are larger, but nowadays I do mostly equine research for that, and it stemmed over from the microbiology aspects to human animal interactions, stress physiology, some of those things along the way there. So that's kind of brought me to here. I teach a lot of the equine classes. So this semester I'm teaching Introduction to Equine Studies. I also have an Equine Assisted Activities and Therapies course. In the spring, I teach equine production and equine health and disease. Lead a study abroad every other year. Also teach in the fall an equine facilities marketing and management course. So if you're interested in taking an equine class, most of them have a lab component. I'm a real big believer in experiential learning. Working with 4-H youth development, I think you can learn a lot. Horses are also great teachers. So I highly encourage you, if you get an opportunity, some of you may in your animal science classes, come out and visit the farm and see some opportunities there. So we'd love to have you out there. So today I'm going to talk a little bit about equine healthcare. How many of you have any horse experience? Okay, so some of you do and some of you don't. So this is going to kind of hopefully cover that for everybody. I will give you a heads up. I like gross pictures, so you will get some of those. So if you have a weak stomach, look away. Apologize, I know y'all are eating, it's not that bad. I don't have videos of the mischievous of us and stuff, that I think is really kind of funny in there. So want to talk to you about healthcare a little bit. So the three covered are some preventative aspects that we do for horses, similar to a lot of other animal species, some routine health assessments, and then some common emergencies. So we're going to try and cover some of those. So when I talk about basics, that covers a lot of things. So nutrition is really important for preventative health, dental care, hoof care, vaccinations, deworming, and management. Probably all are the same. An ounce of prevention is worth a pound of cure. Very, very true. I love my vets dearly. I'm a PhD, not a DVM. I love my vets. Love, love, love my vets. But the less of them that I see, the better for my wallet. For that. So I love seeing them and having great stories and catching up, but not when I have to call them out. So the more that I can do to prevent having to pay that gigantic vet bill, the more I'm going to try and do. So just to touch on equine nutrition without going into kind of a lecture mode, equine nutrition is really basic. They need forage, and that can be grass or hay or some variety of forage, salt, and water. The most important of those is water. Just like with any animal. So if we follow that, should be pretty good on that. So we have what we call this forage first principle. You'll probably hear about that. That means that's the most important thing in their diet, that they need to be eating forage. That should meet all of their needs, and if it doesn't, Then we will add other things like concentrates or grain to it because those are concentrated nutrients. So what I tell most horse owners is they need at least 1 pound per 100 pounds of their body weight in long stem forage. That's to keep that really long GI tract with lots of twists and turns and changes in diameters working so that things don't get stalled, don't get backed up. The other rule of thumb that's really important is you want to estimate about 2 pounds per 100 pounds of body weight that's what they need to eat forage a day. So if we said, hey, I've got a 1,000-pound horse, which if you go out to the OSU farm, most of our brood mares that you've probably interacted with are probably anywhere from 1,000 to 1,100 pounds when they're pregnant, add a couple hundred to that, but that's kind of where they are. So they need about half a small square bale a day, depending on how much it weighs. But that's just a good rule of thumb to meet their calorie needs. Now, obviously, it's going to change depending upon what they're doing, just like with people. And some people require more calories, some people require less, no different with the horses. So why is forage so important? It supports that natural digestion. Horses were meant to eat a little bit, walk around and graze. Eat a little bit, walk around, graze, walk around. Small stomachs, empties rapidly, it's got a long way to go through there. So it's really important that they get that grazing time in to support that natural digestion. The other thing is forage usually has most of what they need in terms of the calories, the vitamins, minerals. So we can adjust the quality if we need more nutrients, maybe give a better quality forage. And if they don't need so much to maintain their weight, maybe give them more of the less quality forage. Kind of think of like if you're on a diet and you get the rice cake, that versus the brioche bread, it's very, very different nutrient densities of those. The other thing with horses is it encourages their natural behavior. So horses forage naturally. If they don't have things to forage, they will find other things to chew on. That might be trees, facilities. They will find ways to try and not complete, but to achieve that grazing behavior, that urge that they have. So we also know, and somebody did a great study, that if they eat about 2 pounds of hay, it takes them about an hour to eat that and about 8,000 chews. Now, wouldn't that have been a really boring but interesting project for you to be the one that counts the number of chews that a horse takes off of that? But then they also looked at 2 pounds of grain, so pellets, textured feed, whichever it was. It only took 10 minutes and 800 chews. So that really signifies the importance of the forage for them for that reason, but also horses continually secrete acid in their stomachs, and they've got a stomach so that part of it is unprotected against those stomach acids. And that chewing helps create some of those buffers to help prevent problems like ulcers and some of the things like that we see in horses that go for long periods of time without forage in their stomachs for that. So if you don't take anything away, forage is important for horses. So dental care is super important for horses. Long gone are the days, and some vets might still do this, or dentists use the hand tools in there, but they really don't. So a lot of them will use power tools like this. It makes it a little bit easier for them, and they can do more horses in a day. So horses are a little bit different, and we have some potential dental issues because of the way that their jaw is. So their jaw is a little bit wider up top than it is at the bottom, and they chew side to side. And I found a funny video, hopefully it'll play. Maybe not. But it shows the horse chewing kind of up close, that side to side motion. So as a result of that, the edges, the outside and inside edges of the teeth can get what we call sharp points on them. So sharp that if you were to put your hand in there and slide your fingers across them, has anybody ever gotten a paper cut off a cardboard? hurts really bad. That's how sharp their teeth can be. So just by sliding your hand in there to check and see if they got those points, you have to be really careful so you don't slice your fingers on them. And you can see on the picture on the left some of, and the picture on the right, that after the lesions or the ulcers in the mouth that those teeth rubbing on the gums can cause. So that can cause additional issues. So vets will do what's called floating the teeth. Basically, it's filing those sharp points down. You don't want to take them down too much, but you just want to take those sharp edges off. And they really run into problems, or the horses do, if they are missing a tooth, because their teeth continuously grow. So they have two sets, their baby teeth or deciduous teeth, and then their permanent teeth. But those permanent teeth continue to grow, and what keeps them from growing and sticking out is it rubbing on the opposing tooth. So when you're missing that opposing tooth, they can grow and then create problems with their ability to chew. Some other things that we do with their teeth, sometimes we take out their wolf teeth, if they have them. Not all horses do, but it's a simple extraction procedure. That's something that we do here commonly in the US. A lot of other countries don't do that unless it's causing an issue. So you will see some cultural differences and societal differences with some management aspects. And the other thing that we commonly do are remove dental caps. So it's the baby tooth, like our teeth will fall out and then the permanent tooth will erupt. So that dental cap, that deciduous tooth may stick on top of that permanent tooth coming in and may not fall off. Sometimes food can get lodged up under it and it can create a problem. So if that's the case, usually you just go in with a pair of pliers and kind of pop it right off. Sometimes when the horses are eating, it's not uncommon to look down and see those caps laying in their feed pan, or they might have dropped one while they were eating. So those are some common things that we take care of. Teeth, we typically recommend checking their teeth at least once a year. Some horses might require a few more times a year if they've got special issues that you know about, but at least check it once a year. Doesn't mean that they'll need to have anything done, but it's a good idea to just at least have it checked. We also want to pay attention to their feet. So you probably heard the saying, no hoof, no horse. And that's true, because a lot of things that they go wrong with their feet can render the horse where it can't walk. They can't walk, probably not going to be able to eat and drink water. And then it's going to become recumbent and then just kind of go downhill from there. So hoof care is super important. The hoof, based on the rate of growth, we usually will have their hooves trimmed about every 6 to 8 weeks. That is very dependent upon what they're doing and the type of terrain they're on. Horses out in the West don't need that. They're on sandy soils, they keep their hooves warm. Our horses, we tend to keep them on soft pastures, nothing that's going to wear their feet down to that same thing. So we will trim their feet. Again, it depends on the horse and what we're doing with that. And I notice I said the word trim. I did not say that we're going to put shoes on them. Many people think that horses need to wear shoes, and that's not the case. There's usually only 3 reasons we would put shoes on a horse: to provide protection. Maybe we're riding over rocky terrain, or they've got really flat soles, or something that we're doing to protect their feet. Or if we want to add or take away traction, maybe we're riding jumpers where we want a little bit more traction if we're jumping on grass. Maybe we want to take away traction if we've got a reiner and we want to do a sliding stop. We want to reduce that traction so we can elongate that horse's sliding stop. So those are reasons where we might utilize shoes. And then to provide some type of correction to that. Maybe the horse has an injury, maybe it's got some type of conformational flaw that we're trying to work with to increase the soundness and longevity. So on those occasions, we would put shoes on. A lot of times horses might just wear shoes on the front 2 feet. Sometimes they will wear them what we call all the way around, but shoes are not a requirement. Just because they're being ridden doesn't mean that they need to wear shoes. Most of the common issues that we see are cracks. So vertical cracks like that are usually from where the toes get a little long and the pressure kind of splits them. You see a horizontal crack, that's probably an abscess that's growing out on the way down. And then we also, abscesses can be an issue, and then thrush, which is kind of a bacteria, anaerobic bacteria that gets in there. It's kind of got a distinct smell to it. Can't really describe it. Y'all are probably not of the generation that have the smelly markers. where like each color had a smell.
Yeah.
Y'all remember those? It's got a distinct smell, kind of like that. When you smell, it triggers your memory, like, I know what that is. Kind of like your microlab sometimes when you grow certain bacteria, you open up the petri dish and you smell it, like, okay, I know that smell. So vaccines, there are a lot of vaccines available for horses. The American Association of Equine Practitioners has labeled or categorized them into two categories. One is for, which that means that every horse in the US needs it regardless of where they are. So if it's one horse on 20 acres, 10 horses on 2 acres, whether you're in Georgia, Ohio, Kentucky, California, all of these horses should be vaccinated for this. The risk-based ones are just that. What's the risk of exposure, the risk of the disease versus the benefit of vaccinating for that? All of the core ones are neurological diseases. So it's a mix of, tetanus is a bacterial one, the other ones are viral, but they all cause neurological symptoms. And this could be changing. 20 years ago, 25 years ago, West Nile virus was a brand new vaccine for horses, and we were just starting to see it be an issue, and it was a risk-based one. And probably for the last 10, 15 years or more, it's been considered a core vaccine. So things do change over time. But those core vaccines we will give, and depending on the risk of exposure, we may vaccinate more than once a year to give them a booster. It just depends. Of the risk-based ones, a lot of times we'll give those top two on the right, the rhino and the flu. Those are both respiratory issues. So for young horses, horses that are traveling, pregnant mares that we want to protect from especially late-term abortions with one of the strains of the herpesvirus, then we'll go ahead and vaccinate for those as well. But those are probably your common ones here in Ohio with most of your horses that are showing or traveling. Deworming. So deworming, I wish all horses were afraid of worms, as in this cartoon depiction. Unfortunately, they're not. Some of the more common ones in horses are strongjaws, or ascarids, tapes, pinworms, and bots. A lot of different, and there's a lot more than that, but these are probably the more common ones that we worry about in horses. So deworming, there's been a huge shift in the way that we think about this in the last 20 years. Any of y'all have goats or sheep? So if you do, are dewormers effective for them? No, pretty much not, because parasite resistance. And we're starting to see more of that in horses, but we're not developing any new anthelmintics. We're starting to look at natural things like tannins and oak trees and some other things as alternatives, because we're seeing a lot of resistance in our commercial products. So we kind of, depending on the age of the horse, we approach it a little bit differently. Excuse me. Our young horses, we deworm starting at a few weeks old, every 2 to 3 months until they're a year of age, regardless of what their worm count is. The older horse, and we do that because of certain types of worms that can be very problematic in the young horses. In the older horses, what we do is strategic deworming by using a fecal leg count. So you take a couple of balls of poop, you only need a gram, put it in the fecal float solution, let it rise, transfer it to a microscope cover slip, let it sit on there, and then check it under a microscope. So we count the type and number of eggs that we see, and then depending on that count, we may or may not deworm the horse. Typically, we look at about 200 eggs per gram. If it's over that, we'll usually deworm. And the type of wormer depends on the type of eggs that we are seeing under the microscope. Sometimes you might see counts as high as 700, and we've seen those in some horses. The goal is not 0. The goal is to keep it under 200, and usually it's problematic children. When I say that, typically about 20% of the horses in the population are contributing about 80% of the eggs. So if we can focus on those high cheddars, we're usually pretty good at being able to moderate the parasite population. And I can't stress this enough, deworm only when you need it with the appropriate product in the correct dosage. So the dosage is really important. We like to throw around this 1,000-pound horse number in there, and a lot of our dewormers, our commercial ones, the paste dewormers that we can give orally, work for about 1,200, maybe 1,250 pounds. A couple of them will be have dosages up for that amount. Our quarter horses aren't that big at the farm. So if I were one of my horses at home that's about 16 hands, probably weighs about 1285, 1310. So one of those tubes of dewormer is not going to be enough to deworm that horse. So if we're not dosing for the appropriate weight, then we're kind of underdosing. It's kind of like not taking your antibiotics for the length of time. Yeah, you're killing some, but you're not getting that complete treatment in there. So always make sure you know the weight of your animal. They make a lot of weight tapes. You can get them for free from the feed stores. Super easy to do. Okay, now let's start talking about assessing horse health. So one of my favorite things to ask in class, and if you've had my class, you're probably like, yep, seen that before on a test or two. So I'm very emphatic about you need to know what's normal for your animal so you know what's abnormal. So you can articulate, I mean, this is a pre-vet club. Most of you, if not everybody, wants to go to vet school. So if an owner calls you and says, hey, Dr. Albers, my horse isn't doing right. Well, what do you mean? I don't know, it's just not right. That doesn't give you a lot of places to start. So knowing what's normal for your animal can be very helpful in communicating that to the veterinarian who can help you. Okay, do you need to come in? Do I need to come see your animal right away, whether it's small animal or large animal? That type of information is helpful. So we're going to talk about ranges of things because each horse is different. So you need to know what's normal for your horse. So what is their attitude and behavior normally like? Are they normally like an, oh my gosh, I'm going to freak out at every little thing? You know, is that their normal behavior? Or are they kind of like, yeah, I don't feel like moving. That's kind of their MO for the day. So if they reverse switch personalities, that's not normal for them. So you got to know what's normal for their behavior. Their appetite. Horses tend to eat a meal. If we give them grain, or they tend to eat it. They're not interested in food that they normally receive, whether it's their hay, they're not interested in grazing. That's a good indication that they're not feeling well in some capacity. So appetite's really important. But then on the flip side, if I've got a stallion during breeding season, he may not eat his grain meal until the next grain meal because he's so busy taking a bite, checking out, okay, is everybody where they were? Did they change where my ladies, you know, kind of making sure what's going on. So it all, again, you got to know your horse. So appearance, what are they supposed to look like? What does their hair coat look like for that? So on this, which one is normal, on the left or the right? If you think the one on the left is normal, raise your hands. Okay. If you think the one on the right is normal, raise your hand. It's a trick question. That's the same horse, different seasons. You got to know what's normal for the time frame you're looking at it. The one on the right is going into winter. Same horse. The one on the left is summer. I could have one on the left in winter if I have them under lights, shorten that hair coat, things like that. So again, got to know what's normal. Hopefully everybody will recognize this is not normal under any circumstances. So we shouldn't see that really long hair coat. So horses can get a disease similar to dogs and humans called Cushing's or pars pituitary intermedia disorder, where that part of the pituitary is affected. And that affects cortisol. It also affects hair coat growth. And that's one of those key signs for that. So that is definitely a metabolic issue and not just their shaggy and winter type of situation. One thing that's a little bit more detailed is you need to look at animals, not just horses, from both sides. Are they even on both sides? Are the legs the same diameter? You know, is the face the same on both sides? Is there swelling on one side or the other? What's that appearance? Can anybody see the atrophy in this horse? My mouse doesn't show. Take a look at that horse's right front shoulder. On this kind of right here. Compared to that. Can y'all see that over there? Okay. So that's not our normal view that we have. Normally we might be looking at it head on. So when we see it standing there, yeah, it looks different, but looking at it from different views to see if it's balanced or there's asymmetry. So it probably shouldn't surprise you that that horse had some soundness issues for that. And over time, that muscle atrophy and that asymmetry caused a change in its gait. Other things that we look at, body condition score is a really important thing that we look at. Please know that body condition score, BCS, is not an indicator of health. It is just an evaluation of body fat. That's all it is. Animals can be too heavy and they can be too thin, like both of the ones that are shown here. Both of those are extremes. So on horses, we look at about 6 different places along their body for it. Fun trivia fact is the guy that came up with the scale that we use here in the US called the Henneke scale for body condition scoring. That's probably the #1 most cited piece of equine research in the world, was him coming up with that. He was doing a nutrition study and had to come up with something besides weight to evaluate horses' condition. Other countries, we use a scale of 1 to 9 on that Henneke scale. Other countries and other livestock use a scale of 1 to 5. So it's important to know what scale you're talking about, because if you've got a scale of 1 to 9, a 3 on a scale of 1 to 9 is different than a 3 on a scale of 1 to 5. And that can be problematic in a whole lot of different ways. So what we usually do is score each part of the horse's body. I'm not going to go through all of those, but you should score each location separately, and it's important that you touch the animal or can be able to feel it, because looks can be deceiving. I can take a horse that's got good condition and turn its head and show you the ribs and make it look like something else. And I can take a ribby horse and turn his head the other way and kind of cover those up. So it's really important that you be able to palpate that horse, because I get lots of calls from folks that are flying by on 33 or other roads, 65 miles an hour, and then want to tell me that there's a skinny horse, for that. So all sorts of different things to think about that, but BCS is important. Again, horses can have health problems if they're too heavy or too thin. So it's important to know how to take some vital signs with those. So some of those are body temperature, which is going to range about 99 to 101.5 degrees in the horse. It's influenced by a lot of things, but this is where you need to know what's normal. So if my horse's normal temp is 99.1 or even 98.6 this time of year, and I go out and not sure what's going on, do a quick temp pulse respiration, and her temp is 101, that's a 2-degree increase. It's still within the normal range. So if I didn't know what her normal was, I'm like, okay, it's her normal range. But for her, a 2-degree spike could mean a lot. So that's where it's important to know what's normal for each animal. Within the range is great, but you need to know if they're at the low end or the high. We also will check their heart rate or their pulse. For adult horses at rest, not running around doing anything, about 30 to 40 beats per minute. For that, it varies with age. Younger animals is higher. So usually up until about a year, like 2-year-old year, we're still looking at up in the 60s for that. So that's very common. So you need to know the age of the animal. Horses can stand completely still and have heart rates in the 60s plus. Usually that's a really good indicator that there's some pain going on internally, whether it's a foot, there's colic, there's an impaction in the gut. So if they're just standing there and they have a super high heart rate, especially over 60 to 80, it's probably going to be something surgical that's going to need to be referred in, or definitely have the veterinarian out. If that's not an option. So respiration, normal respiration for an adult horse, 8 to 16 breaths per minute. It can be as high as I've seen it in the 70s and 80s, but usually that's the horse that's out of shape that just came running in, has been running for a little bit and then stops, and then it'll go back down within 10, 20 minutes, etc. That inversion there, so the heart rate should always be higher than the respiration rate. If it's flipped, we call that an inversion. The respiration rate should not be higher than the heart rate in the animal. We also look at poop and excretions. So I tell my students I want to see both ends, and I'm looking at both ends. Color, consistency. So, what does the poop look like? A lot of it tells me, is the horse stressed? What's the horse eaten recently? With the eyes and nose, it's just a picture of the nose there, but with the eyes and nose, is it clear? Is it colored? Is it thick and mucousy, or is it thin and watery? Is it out of one eye or is it out of both? So that can tell me a range of things. Allergies, uh, infections, things of that nature. So those little differences are important. Horses should always have gut sounds. We don't have a number like, hey, they got to have X amount per minute like we do for the other stuff. But it's important that you hear sounds. If you can't hear it with your naked ear, use a stethoscope. You can check all 4 quadrants. Some vets are really great. They can tell you, like, by the sound, what structure it is in the GI tract that's doing that. Sometimes it sounds like a toilet bowl flushing, and other times it sounds like other things gurgling along the way. So if you don't hear gut sounds with a stethoscope in any of the quadrants, that can be an indication of a problem. We also check dehydration, so a pinch test or a temp test. Just walk up, pinch the skin. It doesn't have to be on the neck, but usually you can just pet them on the neck and squeeze, and then let it go. Count in seconds: 1, 1,000, 2, 1,000, etc. Should go down within 3 seconds. The longer it stays tented, the more dehydrated the animal is. We also look at mucous membranes. The color can tell us a lot. We also look at capillary refill. This will be interesting because I already know I pulled some of these slides coming out, so I'm just going to skip some. So I just saw that. But blood circulation, so open up your mouth, put your gum on it, blank the gum tissue underneath just enough to turn it white, let it go. Count again: 1, 1,000, 2, 1,000. It should be back to what it was before within 2 to 3 seconds. Not going into reflexes, not going into the lameness grading scale. We're talking about lameness today, but there is a scale from 0 to 5, just kind of score the lameness. And usually each limb will be scored. Horses can be scored more than one limb, but that's something that we pay attention to. So now I want to get to the fun pictures. Common equine emergencies. Most of the reasons veterinarians are called or horses are taken in. Usually number 1 is lacerations or wounds, colic, and then eye problems. So all 3 of these might be emergencies, might not, it just depends. But horses are accidents waiting to happen. Hooks that water buckets are hung on with, sometimes they stick their noses in places they shouldn't. Sometimes they simply roll around in the field and then pick up an antler shed in there and come walking back up with that. Sometimes they run through your temporary posts. What I want to say with this and this one, if you get anything in the horse's foot, try and leave it there until it can get x-rayed so you can see if sensitive structures are involved. So I'm saying that is what they say. Trying to do that might be difficult to do, depending on where you find the horse, how far it is, how far away, because you don't want to do more damage and a lot of that, but if possible, try and have it there until it's x-rayed. So all sorts of fun wounds that you can see. One thing about wounds that I want you to know is there's 2 ways that they can heal. One is by primary intention, so that's suturing it up. That's always the preferred method if possible, because it's going to heal quicker and usually is a little bit more cosmetic. And the other is secondary intention, and that's it just healing on its own. It does heal over time, might take a little bit longer, maybe not as cosmetic for that. So both of those can be a little gnarly, but we'll talk about some of those things. So here's an example of one, of the one on this one was healed by primary intention. So similar location, here's one that healed by secondary intention. Just took a little bit longer to do that. One of the challenges with suturing things is that they tend to dehiss. So when one of the things that helps them not dehiss is how soon was the wound found. There's like this golden period. in terms of the immune system before the army of cells come in and really kind of trigger that immune response. Because once you get to that, then you're not going to stop that. So there's more of a chance for it to dehiss because of all of those cells coming in. So one like this was a mare that we had at the farm where she came in through a gate, and that gate latch was about 3 boards over sticking off the post, because over time the posts and stuff move, and she happened to catch her neck on it and sutured back up. You could actually see one of her jugular vein. Luckily she didn't catch that. But this is her wound that dehissed for that, and it healed just fine through secondary intention. So they look really bad, but I'm gonna give you a look into your vet's crystal ball, their magic 8-ball, like how long is this going to take to heal? What's all going to be involved? Because there's a few kind of tricks of the trade that they'll be able to help you with. So here's another one that heals through secondary intention. So pretty rough there on the side. There's another fun one for that, nice and meaty. You can see where they're missing some skin. So sometimes you don't have any other option. You might be able to suture up the structures, the layers underneath. So some of the factors that are going to affect wound healing, the location of the wound. Upper body wounds heal better than lower leg wounds or lower body wounds because you've got more skin, more flesh on the upper body. The horse's lower legs, they don't have flesh or meat, muscles, but from the knees and hocks down. So there's nothing for that skin to stretch over. So it's really hard to get that skin to stretch, unlike the upper body. So you've got a lot more stretch in that upper body. So your upper body wounds are going to heal a little bit faster. The configuration or the shape, orientation of those wounds are going to impact it. So these wounds here that are horizontal, the one on the side, that's going to actually take a little bit longer to heal than say one that's a little bit more vertical like this, because you've got gravity kind of weighing down on that. The degree of contamination I talked about, that golden hour period. If you can get a wound and you find it within 6 to 8 hours of it happening, even if it was the dirty or more contaminated with mud and manure and stuff, the more chance of like a dehissing and things of that nature. But the sooner you find it and get it cleaned up, the much better chance of it healing quicker than a little bit slower. And then the amount of motion. So if you have a wound over a joint, it's going to take longer to heal because that joint is going to be constantly in motion. So depending on the severity of the wound and the location, your vet may actually try and put a cast on and immobilize that joint just to allow that skin and that flesh to start to heal before they start moving on it again. So that way it speeds up that healing process. So all of those things taken into consideration are going to do that. Like this wound, going to heal super quick. It's on the face. You don't have a lot of tension on it. Not very big. This one also is going to heal really well. It's a vertical flat. The problem with this one is where the halter goes for that. So you run into some other issues. So maybe you just use a lead rope or, come up with other makeshift things to do. Horses can get lacerations in lots of places that people may not realize. The tongue. This is why we never tie horses in a bridle with a bit in their mouth. For that, they can rip their tongues. The tongue heals really quickly, though. It's amazing how quickly it will heal for that, but still not an easy thing to do. Okay, colic. We're not going to spend a ton of time on this because we could. There's many types of colics. So there's colics like gas colic, where that's basically distension of a structure. It could be the cecum, it could be the stomach, it could be the small intestine. We can also have impactions or obstructions of that where things block it from within. Feedstuffs, foreign objects, things of that nature. We could also have what we call strangulation obstructions, and that's where things kind of either twist or impede it, like adhesions from external to that to where it's causing an obstruction, but it's something happening from the outside. Older horses get fatty tumors sometimes that can wrap around parts of the GI tract. So lots of different types of colic, lots of different causes of that. Dehydration, so not drinking enough water, things kind of slow down in there. Internal parasites can cause issues. Gas, changing feed really frequently. So y'all are college students, right? You probably have a very similar diet throughout the week, you know, just you kind of eat the same things. How many of you eat mac and cheese at least once or twice a week? Okay. So for those of you that eat the bland mac and cheese, I love mac and cheese, but you eat mac and cheese, your body is used to it. And then you go out and have like Mexican or Thai or something really spicy that your body's not used to. What usually happens to you afterwards? Y'all are smiling because you know that you probably got gas or other things going on for that. So same thing with horses. When they eat something that they're not used to, it's feeding different microbes, which is going to cause a lot of gas, which can cause maybe a gas bubble. They pass it, it's fine. Or maybe they're like this horse, where it's like, oh my gosh, I hit my toe and I'm dying, you can't walk. So horses are different, just like we are and other animals are in terms of their pain tolerance. So there's lots of types of colic, lots of causes for it. But there's only two ways in. So we can only get about 4 to 6 feet in from with a nasogastric tube into the stomach. Can't get past there. And we can only get arm's length in the rectum. So how colic is often diagnosed, the clinical signs. Are they pawing? Are they not eating? Are they sweating, standing still? Are they rolling, looking at their belly? Are they standing and stretching like they have to urinate if it's a male horse, but they're not dropping down and urinating? So examination, temp, pulse, I know. Temp, pulse, respiration. So other than that, tube of course, see if there's any reflux, put anything down. Rectal palpation, see if anything feels abnormal. So we kind of only have those 2 points of entry to try and diagnose things. Sometimes a belly tap or paracentesis, ultrasound, sometimes surgery is the diagnostic because they'll go into surgery, exploratory surgery, and see if they can find something if they're not quite sure why. So colic's also probably the #1 cause of death. That laminitis are probably your top 2 causes of death in horses, not just here in the US, but worldwide. You know, it affects all of them, laminitis, regardless of the breed, the stage of production, performance level, age can affect all of them. Same thing with colic. So I want to finish up on some eye injuries. Eye injury, always an emergency. Always, always, always an emergency. Even if it ends up being nothing, you don't want to wait because that could mean your horse could lose its eyesight very easily. So when doing things, you know, again, take a look at this. Do you see any differences between the two sides of the face? So looking at that asymmetry when you're going out there, sometimes the horse may have an issue that maybe the owner or the caretaker is not aware of. So making sure even if they tell you, hey, this is going on, look at the horse yourself. Sometimes we get barn blind. We're so used to seeing the animals all the time that we kind of miss stuff that other people might catch right away. When they tear an eyelid, always need sutured back up. The quicker the better. For that, they usually do well, and then they go and do it again or pull their stitches out and create issues. A lot of times that happens with the horse that puts the bucket hook on its nose and then does it again before they get their stitches taken out. And sometimes like rip a whole nostril off. At least the one I showed you at the beginning, the hook stayed in it so it can be backed out instead of just ripping a big part of it off. For that, so eye emergencies, always the case. Sometimes there's severe ulceration of the eye, so that's really important. Sometimes they have to do the fluorescein stain to check it. Other times you might be able to see scarring or some tissue there, maybe even blood within the eye itself. There are other issues that can cause inflammation, that can cause some pain for horses. Sometimes those can be chronic. So it's important to kind of catch those things so that way you can be proactive about the management instead of managing flare-ups. And I will say one thing with eyes, not only are they an emergency to be checked out, they are not fun to treat. The horses, they tend to be very painful, even when you're giving them analgesics and anti-inflammatories. And if they know something's coming, because typically with eye medications, they have to be administered frequently for over multiple days. So we're talking 3 to 4 times a day for several days. Day 1, you're good. Day 2, if they don't want you near their face and they're taller than you and they're a giraffe, so you can't reach them. Sometimes that makes it a little bit challenging, or they use their head as a battering ram and don't want you in there. That can be real problematic. So one of my favorite things that I always like to recommend, and if I ever have an eye issue, I always say, hey, let's just go ahead and do this. It's called an indwelling catheter, which you can put a catheter in through the top of the eye. So you can put the medication in the catheter down by their mane and scratch them and rub on them and push that syringe in, and it goes right into the eye, over the eye where you need it without having to fight and fuss and keep their eye open and worry about getting that in there. So all sorts of tips and tricks that y'all will learn on your journey in medicine. So that's all I have. It's just a real quick wham bam. There you go. Does anybody have any questions? Yes, ma'am.
Do horses get cherry eye?
Not like other animals do. They can have issues with the third eyelid, but not to the same extent. What we tend to see mostly in horses, and it's kind of like with goats, because I also have goats at home too. The entropion, where it rolls in on itself, so it has to be kind of tacked up and sutured up till they get out of that, but they don't usually have. Usually most of their eye issues are where they have rubbed on something and they scratch the cornea of their eye, and then that becomes inflamed and it gets scar tissue, and then we can start affecting their sight. Some horses get periodic inflammation, uveitis. So with that periodic inflammation, that can cause issues when they are going to want to rub or be itchy, things like that. Sometimes it's injuries, things getting into their eye that's going to cause a really big tear for that, but not the cherry eye like you see in small animals.
Okay. Do you often run into dystocia issues in your equine production course? Okay, fair. Sorry.
So let's bring those pictures. So we have had some. I've had some really. It's cool now, but it wasn't cool in the moment. The owners thought that they were sure of the breeding date, and the mare was registering high enough on the milk calcium, and it was past 300. It was like 345 days. So the vet induced her. They were off breeding cycle, and she had twins, and they were born alive. So they had to be euthanized as soon as they came out. So that was a dystocia. We had one born as a friend of mine's, her show mare. She was a maiden mare, never had a foal before. The weekend she went out of town, the mare was on foal watch, and she exhibited all the signs, and we saw the muzzle with no legs. So proper presentation is the front legs with the head behind, kind of like in a diving position. Really important that those shoulders are offset to help ease their way out. So no front legs. Spent quite a bit of time looking for legs to see if we could get a foot forward, because a leg back is probably the most common of an abnormal presentation. For that, no legs. Not one, not two. Could feel shoulders, couldn't even feel elbows. So we said, okay, the foal was trying to come out, so we let the mare have it. And if you take production, you can see the pictures. No front legs. No front legs, no appendages, closed shoulder joints, but it was born alive. So obviously euthanized right away, and upon necropsy also had a blind anus and a herniated diaphragm. So it's got all kinds of jacked up. We have had some dystocias where contracted tendons and can't come out, and it takes 3 vets' arms in 45 minutes. with OB chains, but by that point, I'm like, can we just use the OB saw and bring it out in pieces? Because then you're worried about the health of the mare, as well with that much trauma. Some large foals, sometimes maiden mares with really large foals that require some extra support in getting that out. But fortunately not any that couldn't be managed on the farm. I've only had one that had to go to the vet school. But the foal was already dead, for that, but you couldn't get it out. Okay, good question, but yeah, we don't like the sushi. But keeping an eye on them and checking usually can help with that. And if you ever do run into that with an animal, especially a large animal, get them up. Make them stand up, let gravity kind of help the weight of that animal back down in there. So if you have to adjust anything, that's a little bit easier than if they're down for that. Any other questions?
This might be a challenging question, but I know you talked about the one case with the mare that had that neck maceration. What has been like the most interesting or challenging case that you've seen either at a facility with your horses, or any that you've seen in general? Anything that like really stood out to you?
Usually when they stand out, it's because it's a pain in the butt to treat. Eyes I hate just because they don't enjoy it after like day 2, especially on a young one that's not used to handling anyways, and then you're like, I'm here, the fingers going into the eye with trying to get the ointment in there. So love the indwelling catheters, love them, can't rate them high enough. Even if you're not sure, you want to have them put one in before they leave. The thought, because then you'll be like, if the next time you can't get the tube and you're like, can you turn around? I know you're 10 minutes down the road, but I thought I could get this, but probably the more challenging one has been some of those, what I call the intermittent colics. So I'm a firm believer in, other than the pedunculated lipomas, those fatty tumors, most colic is a management issue. So your dehydration, internal parasites, something along the way. We had a pink stallion that would have intermittent colic, and a little bit of Banamine, wonderful anti-inflammatory, clear right up. But it was almost, sometimes horses get a little colicky, like crampy. It seems sometimes when we have weather changes, like this change in weather that we've had. I'm sure the vets have been seeing quite a few more calls. Plus the horses still aren't drinking as much with the drop in the temperature. We're giving them more hay, more dry stuff that's kind of slowing things down. But the reason why I say that is this probably went on for a few months. Tests, everything's fine. And he ended up not responding to Banamine, and they did a belly tap on him, and he had a lot of cloudy fluid, turbid fluid in there, and just kind of went downhill real quick. And on necropsy, he had what was called venous arteriitis, something that's not very common. And he was on a pretty strict deworming schedule when he got donated, I think, as a 2-year-old. But what that was is, a lot of times we think about internal parasites and the damage that they cause when they're in the tract, in the GI tract. But this was damage that when the larvae were migrating through the blood vessels, it basically damaged the blood vessels and kind of occluded them to where it blocked up enough. That's why it was intermittent colic, like with the blood vessels being blocked. And it just wasn't something very common. So those intermittent colics, like you're not sure why they're colicking, for me are a little challenging, because it's okay, what is it aspect of it. But I like the growth story stuff, but abscesses, not like the ones on the feet, but like just like bite marks. I will caution y'all, so a lot of y'all are shaking your head, familiar with Banamine. Wonderful. And it says that you can give it intramuscularly to horses. Please don't. It can cause clostridial myositis, and basically the only way to get rid of it is slicing the neck to look like it's sliced cheese, or a cheese grater to let air get to all of the bacteria, the anaerobic bacteria, and a lot of times. That, for whatever reason, and I still don't know the whys of it, but vets will tell you, do not give it IM, you can give it orally and you can give it intravenously, but even though it says so on the label. Do not give it IM, because the risk of when they get that, and that takes a long time to heal and to clear up. Thank y'all very much, I'll stick around for a couple minutes.